Spleen enlargement is a severe medical condition. When the tissue expands, it compromises the patient's entire physical routine, escalating into a critical health crisis. When a patient presents with these symptoms, the standard response follows a set protocol. Doctors order physical exams, perform ultrasound scans, and search for a biological trigger. In many cases, however, no physical cause exists. The patient has not ingested toxins, nor have they suffered an infection or blunt force trauma. The spleen begins to swell without any external provocation. This creates a diagnostic vacuum. Without a clear physical catalyst to target, patients often enter a cycle of chronic symptom management, relying on daily medications for years without reaching a resolution. Astrologer A. Saroge argues that these cases remain unresolved because the medical community searches the physical world for a cause that exists on a different plane. Treating an unexplained chronic illness therefore requires a diagnostic lens that looks beyond the physical body and the immediate environment. Vedic medical astrology identifies the origin of these spleen issues in the patient's nativity, their exact birth chart. Practitioners map vulnerabilities by analyzing the 5th and 6th houses of this chart. These coordinates serve as the blueprint for internal organ health. The specific connections between these houses and the nakshatras, or stellar constellations, dictate how an organ functions throughout life. This interconnected framework creates a hidden, predestined map for the patient's internal systems. Because this blueprint is set at birth, standard physical medications often fail to provide a permanent fix, leaving patients dependent on drugs that never reach the source of the imbalance. Under this framework, the human body is a physical manifestation of a fixed cosmic timetable. To correct these imbalances, practitioners utilize Vedic gem therapy as a non-medical intervention. The treatment is timed to the Mahadasha, the reigning period of a specific planet. This determines which cosmic energies are currently exerting influence over the patient's health. The therapy relies on gemstones to emit targeted cosmic radiations. These stones must be aligned precisely with the patient's active Mahadasha to be effective. The physical body absorbs these precise doses of radiation, which are channeled to the spleen, balancing the planetary influence and stabilizing the tissue. This approach frames gem therapy as a form of precision energetic physics operating outside the boundaries of conventional medicine. When these planetary radiations are applied correctly, spleen issues can begin to resolve within a matter of weeks. This timeline offers an alternative to the lifelong dependency often associated with traditional pharmaceutical routes. Accuracy is paramount. Generic solutions are impossible because the therapy depends entirely on the unique calculations of an individual's nativity. Decoding this blueprint requires 3 specific data points: the exact time, place, and date of birth. Patients seeking a customized analysis can submit these 3 details along with their medical records via the email address in the comments for a private consultation. This philosophy achieves healing by realigning the body with its exact cosmic origins.